Today we are going to see the next important topic in neurological instrumentation, that is auditory evoked potential. So the learning objective of auditory evoked potential is that here we will be discussing the different types of auditory evoked potential, and we will have electrode placement techniques and what are the electrode placement site, and how many electrodes we will be using to record auditory evoked potential. And then also we will be discussing what are the different key components of waveform which is being produced by this particular technique. And finally we will also be discussing a different clinical application in hearing assessment, and then stimulation parameter, what are the different types of stimulation parameters we'll be using to have a response or to record the response of this particular techniques. And finally we will apply this principles for diagnostic purpose. So let's move on to the topic. Before getting into this, first we need to empathize what is the problem and what is the need, and how the solution will be brought out here. So the thing is, the problem here is that nearly 466 billion people worldwide have been disabled, have been affected by this particular here impairment. So 1.1 million young adults having risk. They are at risk due to the noise exposure. So if you see now these days the infants, even young, very young people or babies, they have a problem with their hearing loss. They are very much needed of ear reduction. So that is the reason there is a need of objective assessment for auditory pathway. They need non-invasive techniques so that it is suitable for any sort of age people, right from infants to the elder people. So this, if we have the such a kind of assessment or non-invasive techniques, if it is have capability to analyze the problem at early, then if we can have the chance of improvise the people quality of life. So that is the need for this problem. So as a solution, if you see, to address the problem, we have auditory evoked potential they have brought into the picture, because it is provide very good objective assessment as we discussed already, as a need. And then we have it give very good assess entire of auditory pathway right from the ear to cortex, that is the brain sensory brain part. And then it will enables to give early intervention under treatment planning. That is the main objective, offering as a solution for the problems and meets the need to address the problem. So these auditory evoked potential it's a particular technique which transform the treatment, subjective treatment to the objective assessment. So next we'll move on to the main part, that is what is mean by auditory evoked potential. So auditory evoked potential is nothing but it's a kind of evoked potential is being generated in the auditory pathway in response to the different sort of acoustic stimulus. So the main principle is that here we will be placing the electrodes where you want to measure, and then we will giving the sort of stimulus through your ear. Then we'll be recording the action potential, that is the response for the stimulus, and we'll be analyzing whether the latency period of that waveform components, whether within the limit or not, and then we can easily localize where the problem is there. That is the auditory pathway right from the ear to the cortex. So in the right hand side I have given the auditory pathway picture. So you can see from the ear, external ear to then spinal cord, then you through the nerve it's going to the sensory part of your brain, that is the auditory cortex, and then thalamus. So this is the path track we are going to monitor in this auditory evoked potential. So we have three different types of auditory potential. First one is BAEP, that is a brainstem auditory evoked potential. Second one is the ML or middle latency response, and third one is LL or long latency response. So BAP brainstem auditory evoked potential is commonly used because it is used for hearing screening and to give clear understanding of a different neurological disorder. So that is a reason we are using this BAP as a more common method, because it gives a clear pathway track track of assessment right from auditory nerve to the inferior coccyx. And then MLR, which is being used for auditory processing assessment, and LLR for cognitive process assessment. So there are other two different types, but the most commonly used is a BAEP method. So electrode placement as like somatosensory and visually evoked potential. And here also you are using international 1020 electrode system. Here we are taking three electrodes. One is recording electrode, reference electrode, and ground electrode. Recording electrode is the active electrode where we are going to place it on the sensory part of your brain, that is the occipital, auditory cortex, that is temporal side. And then reference electrode is we will be placing at the left mastoid, and the ground electrode will be placing on the right mastoid. So the key consideration for this electrode placement is that electrode impedance should be less than 5 kilo ohm, and the skin preparation should be taken into consideration, because in order to overcome the artifacts, we can go with alternative placements like FZ, PZ instead of CZ. And then we can have a reference point as a mastoid, or you can have a ear lobe or prefrontal area, like that. So these are the three key consideration we have to look at before getting into the electrode placement. Now we will move on to the waveforms of BAP waveform components. Here we have different types, like different location in the auditory tract we can monitor. One is auditory nerve, second one is that is distal and proximal, and second one is cochlear nucleus, and lateral luminoscus, and inferior colliculus. So these are the area. In previous slide in the diagram you can see these particular part in this stroke. Okay, the cochlear nuclei, and the superior part here, and lateral luminoscus, and the inferior cocculus. Here you can see the different parts. These are the parts we can easily visualize as a different components in the BAP waveform. And each waveforms have a different latency period. If there is any delay in this latency, we can easily identify the area where the problem is lies and what is the reason. Later we can diagnosis. Later we can do the diagnosis. So we have the clinical significance like cochlear lesions, brain system pathology. We can do it. We can identify if there is any severe hearing loss. For example, if a wave 5 is absence, if the wave 3 is delay, means then there is a pathology problem. And wave 1 we can see any increment in latency, means then there is a cochlear lesions. So like that you can see the latency difference. Based on that you can identify what is the problem is there. And we have two types of stimulation methods. One is click stimulation, another one is tone burst stimulation. The click stimulation is like have a condensation rarefaction polarity, like intensity in the range of 60 to 80 we can give. It is like very short, frequency you can be repeated over period of time. It is commonly used one. Whereas the tone burst stimulation, here it depends upon the frequency, you can give for a brief short pulse, like 500 to 4000 hertz. It has a frequency. We can vary the frequency according to the patient condition. Similarly, it has a different set of intensity, rate, and duration as like clinical click stimulation. So these are two different stimulation methods we will be giving in case of auditory evoked potential, and we'll record the stimulus according to that. The clinical application of this particular thing is that we can have very good hearing assessment, especially for the newborn screening for hearing loss, and it providing objective threshold determination, and having very good functional hearing assessment in case of uncooperative patients, and it give a very good neurological evaluation like multiple sclerosis diagnosis, brainstem less diagnosis, better diagnosing method for coma people also, and other research application and inoperative applications also there for auditory evoked potential. So these are the comparison. You can see different sort of evoked potential, auditory, visually, and somatosensory in terms of latency, range, amplitude, what type of stimulus type we can give, and what are different clinical application. Finally, advantages of each type of evoked potential. So the overall I have given here a summary. Like in summary, auditory evoked potential, we have covered so many things, like right from basic principles and types of auditory evoked potential, electrode placement, and different stimulation method, and finally we will discuss the clinical applications of auditory evoked potential. Yes, these are the reference. Thank you.